Hey students, do you have problems answering nursing questions? Well, stick around. Let's go over 3 different types of nursing questions and see if this might help. Hi, it's the nursing professor here. I want to break down some questions a little bit further and help us with coming up the right answer for our test questions. All right, so the first one is a select all that applies. So listen up. A nurse is caring for a client who fell in a nursing home. The client is alert and oriented to person, place, and time. They can follow directions. So, which of these following actions should the nurse take to decrease the likelihood of another fall? Select all that apply. Your choices are place a belt restraint on the person when they're on the bedside toilet. B, keep the bed in the lowest position but have all 4 side rails up. C is to make sure that the client's call light is within reach. D is to provide the client with non-skid footwear. And E is to complete a fall risk assessment. All right, so what's your choice here? So let's look at A. Put a belt restraint on a person? Absolutely not. B, keep the bed in the lowest position would be a good idea, but not all 4 side rails up, because that's a restraint. C, make sure the client's call light is within reach. That's a good idea. D, provide the client with non-skid footwear. That's a good idea, because if you get up, then he's not going to fall. E, complete a fall risk assessment. Yes. So your answers would be C, D, and E. All right, so did you get that? Hopefully you did. All right, so let's move on to the next question. All right, question number 2. A nurse is working in a provider's office and is preparing to auscultate and percuss a client's abdomen as part of a routine physical. Which of the following findings should the nurse expect? So these are findings that the nurse should expect if they're doing percussion on the person's abdomen. A, tympany, probably. B, high-pitched clicks, probably. Those are bowel sounds. C, borborygmi. D, friction rubs. And E, bruits. So your answer is A and B, because friction rubs, not heard in the belly. Bruits, typically not heard in the belly, but if they are not high-pitched sounds, and neither is borborygmi, which sounds more like a growling sound in the abdomen. So again, this is why keywords are important, because you had to know what each of those words meant in order to get the right answer. So hopefully that helps. Got time for one more. All right, number 3. A nurse is assessing a client who has an acute respiratory infection, increasing the risk for hypoxemia. Which of the following findings are early indications that should alert the nurse that this client is developing hypoxia? Select all that apply. Okay, so hypoxia, not getting enough air, signs of shortness of breath. All right, so your choices are restlessness, probably, tachypnea, probably, bradycardia, probably not, D, confusion, probably, and E, hypertension. All right, so this question is asking about signs or symptoms a person may show if they're having problems breathing, having hypoxia, and this person has a respiratory infection. So your answer should be A, B, D, and E, not C. Because when a person has difficulty breathing, their respirations go up, their heart rate goes up, because the body is working hard to try to get more and more oxygen into the system. So hopefully that helps. Use that technique, or all those techniques that we've discussed this week when trying to answer questions, and check back in. Let me know how that worked. Bye for now.